I think that there is two steps. The first step is the suspicion. And the suspicion, it's on the basis of the clinical examination and most of the time of the symptoms of the patient. And most of the times the symptoms are symptoms of heart failure. So in this patient, we are going to suspect cardiac amyloidosis on the basis of the ECG with typically low voltage or conduction disorders, and the echocardiography with left ventricular hypertrophy, and typically longitudinal strain apical sparing. This is the typical pattern of cardiac amyloidosis. And after that, in some countries, depends of the countries and depends of the habits of the countries, but in some countries we are going to do the MRI. And the MRI is going to show an increase of the extracellular volume and typical pattern of late gadolinium enhancement with sub-endocardial late gadolinium enhancement. And in this case, we are going to suspect cardiac amyloidosis. And the next step will be to confirm the diagnosis of cardiac amyloidosis. So previously, the gold standard, and it's still the gold standard, it's the biopsy. The biopsy can confirm the amyloid deposition within the myocardium. But now we know that we can make the diagnosis of cardiac amyloidosis using bone scintigraphy. Bone scintigraphy is a really useful and really sensitive tool to the diagnosis of cardiac amyloidosis, and particularly transtiretin cardiac amyloidosis. Because in case of transtiretin cardiac amyloidosis, ATTR cardiac amyloidosis, you will have a myocardial uptake of the bone tracer. That means that if you are doing a bone scintigraphy, you will see that the patient with ATTR cardiac amyloidosis are going to show an uptake of the bone tracer on the heart. It's really important to understand that even in case of light chain amyloidosis, you can have a positive bone scintigraphy. So before making the diagnosis on the basis of the bone scintigraphy, it's really important to rule out monoclonal gammopathy. And to rule out monoclonal gammopathy, 3 tests are mandatory: free light chain assay in the serum, and urine and serum immunofixation of the protein. And if there is no monoclonal gammopathy, and if there is a positive bone scintigraphy, you can make the diagnosis of ATTR cardiac amyloidosis without the need to do a biopsy, extracardiac or either a cardiac biopsy.